Hi folks, Dr. Beyer here. I'm making this video for two reasons. One, I want to personally invite you to come to my workshop this Wednesday evening at 6:30 to be held at my clinic. It's going to be 1 hour long on chronic fatigue syndrome. Those of you who know me, my practice, I specialize in functional medicine, functional neurology, and treating chronic disorders. The one common symptom in all chronic illness is fatigue. It's the number one symptom that I hear. We're going to be addressing this, why you're fatigued. There's multiple reasons why. The second reason I'm making this video is to share with you a young or woman, middle-aged woman named Jennifer, who came to me from the north side of Chicago, and she was suffering with fatigue, fibromyalgia, brain fog, and here's her story. Okay.
Okay, my name's Jennifer Neese. I'm 45 years old.
Jennifer, tell us a little bit, you're ending your treatment today, right? Tell us a little bit about your health status when you started with us about 6 months ago.
I had chronic fatigue, depression, a lot of muscle aches, joint pain in my knees, elbows, shoulders. I had brain fog. I basically really couldn't function.
And you're a mother of how many children? Two young children, right? So that was not a good way to live. How'd you find out about our office?
Online. I was searching. I was diagnosed with fibromyalgia, and I had seen rheumatologists, but wasn't really happy with the medications I was on. It was making my symptoms even worse. So I was just searching different types of treatments for fibromyalgia, and your name came up. It said, I think, fibromyalgia in Tinley Park.
Okay, and you come quite a distance, right?
Right, from north side of Chicago.
North side of Chicago, so about an hour or something away. Yes. Okay. Now, overall, compare your health today to what it was like 6 months ago when we started our program.
I would say I'm probably about 90 to 95% better.
Okay. And you can do a lot more now, your energy levels and pain levels?
Definitely. Energy. The most important thing is my whole outlook has improved.
Excellent.
With that, and because of that, I'm able to do more things.
Mm-hmm. So you feel like the brain fog is lifted,
yes.
and you're just thinking more accurately now.
Yes.
Okay.
Oh, absolutely.
And your overall pain and your muscle aches and everything?
It's like 95% gone. And some days it's 100% gone. It does depend on what I do. I have to be careful with that, but
and you're still going to improve. You just
right.
don't really need me anymore. Now we've had to make some changes, correct? Okay. What were some of the things that we found on the lab tests? Like, for example, with food sensitivities.
Right. We found out that I was gluten intolerant, dairy intolerant. I know you said I was hypoglycemic, which I never knew. A lot of my levels were off. I think it was low in vitamin B.
Okay, and we addressed all those issues.
Yes.
And you had to make some lifestyle changes. Obviously, we had to remove dairy and gluten, the foods that you were reacting to out of your diet. Now, be honest, it wasn't so easy at first, was it?
No, but once I started for that first week, I felt probably about 40% better. It was the initial getting rid of all of that out of my system. And then, so the fact that I felt better allowed me to stick with the diet. Because I knew if I'd go back to it, I'd just resort back to laying in bed all the time and exhaustion.
Excellent. Now, you'll never go back to that way of life, will you?
No.
All right, so your outlook in life is different.
Absolutely.
For someone suffering with fibromyalgia and the things that you're suffering, would you recommend that they at least investigate what we do here?
Yes, absolutely. Even if you're not diagnosed with fibromyalgia, but you have the same types of symptoms, I would definitely give your office a call. I tell a lot of people about you, and I don't know if you're receiving calls or not, but you know, it's really important, I think, to realize food intolerances. I think that's the key to all of it. Yeah,
cleaning up the gut. You also had some infections too, correct?
Yes.
In your gut, we had an H. pylori infection that we cleaned that up without medications.
Right.
So that was a good way to go. Okay. Well, thank you, Jennifer. Appreciate it. Okay. Now, when Jennifer first came to me, as you heard, she was chronic fatigue, brain fog, a lot of joints and achy pain in her joints and etc. What she had, you have to do the proper testing, because the reason why you're tired and the next person's fatigued could be totally different. Now, what she had wrong was she was suffering from multiple food sensitivities, which was causing chronic inflammation and robbing her of her energy. And we identified those through a specific lab test. And she was also suffering from gut infections. The other thing that she was suffering from was her mitochondria, the powerhouses in your cells that take your food and convert it to energy, were hardly functioning at all with her. She was severely lacking in certain B vitamins which weren't being absorbed in her body, and certain enzymes that you need for the mitochondria to be able to produce energy. Once we cleared that up, well, you saw what happened to her. She got her life back. Folks, you don't have to suffer with fatigue. You don't have to spend your life this way. The medicine, traditional medicine, has no answers for this. We do. So if you're suffering from fatigue and you're sick and tired of it, please call the number, attend our workshop. You'll be glad that you did, and I look forward to seeing you there.
If you would like to attend this Wednesday's workshop, please call 708-336-3392.